Here you are seeing the pelvis of 40 years old female with severe excruciating pain, tender to probe, and this is the severe pelvic pain radiating towards the left side, left pelvic region. Now this is the status of the uterus and sorry to add in at this very moment that she is bleeding by vagina for the last few days with severe pain. And here we see the uterus in longitudinal section measuring approximately 11 centimeter by 6.5 centimeter, and this is a right size in anteroposterior diameter. It should not exceed 5 centimeter, but you are seeing a 6.5 centimeter, and this is the urinary bladder longitudinal section, anterior myometrium, posterior myometrium, cervix, vagina, and now the transfer section. This is the transfer section, the uterus in transfer section. Okay. Measuring approximately 7.2. Normal is up to 5 centimeters. So the dimensions are raised, and the echogenicity of the myometrium is normal, not. I'm sorry, I'm having flu, we feel change in the voice. Now see that the endometrial canal. Let's concentrate on the endometrial canal. This is the endometrial canal. It's dilated up to 29 mm. Normal should not be more than 14 mm, and in longitudinal section you will see it's filled with echoes. These are all echoes, and there is a tiny calcification also seen in this area, this spot. Now this is the endometrial canal measuring 27 mm, filled with echoes, and the area marked is that of endometrial canal. No focal lesion seen relating to the myometrium. So echo-filled dilated endometrial canal. When I go to move toward the probe towards the left side, what I see is that the area where she is more tender, extremely tender to the probe, I see a tubular structure, this one, extending from the left adnexa, measuring approximately 3.2 centimeter by 8.9 millimeter. And if you note that in this tubular structure there is seen a central hypoechoic, rather anechoic area, this one. This is the area of study, and this, this tubular structure, this one, central, measuring approximately 1.8 millimeters, is in fact dilated fallopian tube with dilated fluid-filled lumen. Now this is the left fallopian tube, This is the left fallopian tube, and we see this tubular structure is the dilated lumen, which is filled with fluid. Normally, you will be in normal ultrasound, we can't see, or we do not see a normal fallopian tube. It cannot be seen with 2 DDL, at least with 2-dimensional real-time ultrasound. So, patient is very tender to this medium. So what we have seen is a relatively enlarged uterus, echo-filled dilated endometrial canal that is representative of bleed within the endometrial canal, then a hypoechoic tubular structure extending laterally from the corner of the uterus, and in which a central, this is the area, and the central fluid-filled tubular structure, which is suggestive of dilated lumen of this fallopian tube. This is the fallopian tube, and now is the right ovary. So this is the uterus, and here you will see the right ovary, this one, and you can see developing follicles within it. 1, 2, 3. Not only that, there is fluid seen. There is fluid seen in the pelvic cavity. This one. This is small amount of fluid, though, seen below, posterior to the uterus, in the pelvic cavity, and this area giving posterior shadow. This one, echogenic area shadow, is the clot. She is bleeding. The cervix is cervical canal is also showing mild dilation. This is the cervix, cervical canal, and you can see fluid in the cervical canal as well. Now this is the cervix. This is cervical canal fluid filled. This is the bright echogenic area giving posterior shadow is a clot. As I told you that she is bleeding, and you can see fluid in the vagina as well. So this is our case of the day. Without any history, clinical examination notes or lab findings provided. This is a case of, I am going to report the findings only, as it's very difficult to comment on the diagnosis, sonographic diagnosis in this patient. The endometrial canal is echo-filled. Different strength equals are seen, and as such no RPOC is seen. This is the endometrial canal. It's difficult to get the left ovary though. Now this is the structure that I am talking about, is the fallopian tube with dilated lumen within it. In the center we see a tubular structure, which is in fact dilated lumen of the left fallopian tube. This is the lumen of the left fallopian tube. This is the left fallopian tube. And this is the echo-filled endometrial canal of the uterus seen in transverse section. Thank you very much. This is our case of